Hello, this is another podcast brought to you by Iranian Surgery. In this podcast, we are going to talk about Brazilian butt lift aftercare and long term situation. Nowadays, many applicants are looking to improve their body image and appearance, but they also want to have a normal, healthy life. So, some questions arise, such as the following: what will happen 10 years after having Brazilian butt lift? Would Brazilian butt lift result in death? When can you sit after BBL surgery? How long does the recovery take? Do people need to do revision BBL after 10 years to get the first result look back? In this podcast, we are going to talk about overall concerns of BBL applicants. First of all, we are going to talk about Brazilian butt lift and its side effects. Many nowadays are worried to have a fatal incident in surgery and die undergoing a cosmetic surgery procedure. You should know that Brazilian butt lift is one of the safest cosmetic surgeries, and BBL procedures have been known to cause death in some cases, with the current fatality rate being 1 in 3,000. However, in almost all reported fatality cases, it was the surgeon who wasn't professionally trained and incorrectly performed the procedure. Inexperienced surgeons can and have incorrectly injected fat into large veins or muscles in the buttocks. This enables fat to travel up into vital organs like lungs and heart, clogging its vessels and resulting in death. To avoid any possible risks and complications, seek professional advice and make sure you follow your surgeon's post-surgical advice carefully. Now that we know the danger of fatal incidents are low if you choose the right doctor and medical team, we are going to talk about BBL overall recovery. Here is a Brazilian butt lift recovery week by week timeline. What happens immediately after BBL? Prior to your surgery, you'll want to enlist a caretaker. This can be a friend or a family member who is responsible for driving you home post-op and assisting around the house for several days. Immediately after the procedure, you will experience some soreness, bruising, and swelling. There may also be an initial feeling of numbness. If you are in pain, tell your surgeon so they can prescribe medication to manage the discomfort in the coming days. When you arrive home, alternate between resting and taking short walks. The exercise is necessary to reduce swelling and support circulation. Your surgeon will give you detailed instructions on how to care for your body during the rehabilitation process. Remember not to put direct pressure on your buttocks. You will be advised to sleep on your side or stomach. Utilize a donut or inflatable booty pillow. If you need to sit down, make sure that when sitting, the pressure is on the posterior thighs so that it doesn't impact the grafted fat. Week 1. During the first week, your surgeon will instruct you to wear a compression garment for the areas treated with liposuction to minimize swelling and fluid retention. It can also decrease discomfort and help the skin retract according to the ASPS. Continue to utilize the booty pillow to keep pressure off your butt. Your surgeon may ask that you schedule a follow-up visit to review healing. Lymphatic massage is helpful to start at this time to help boost healing and treat early scar tissue. Now to week 2 to 3. The pain and tenderness should subside dramatically. However, you may continue to experience slight swelling. Avoid sitting unless utilizing your booty pillow. Consult your surgeon about whether or not you can begin driving. Avoid heavy lifting and continue taking short walks. During weeks 4 to 5, you can begin taking longer walks and resume light exercise. Do not lift heavy weights. You may also return to regular household chores. You may continue to feel slight pain or tenderness. If serious discomfort persists, call your surgeon immediately. Week 6. A majority of patients should no longer feel discomfort or soreness at this point. If your recovery is going well, your surgeon will allow you to resume lower body exercise. By week 6, you should also be able to see visible results of your liposuction and fat grafts. Know that up to 40% of the transferred fat may not survive, regardless of your recovery care. This is a loose healing timeline. Everyone's body is different. Factors such as age, health, and medical history can impact your individual recovery. Consult your surgeon for more information. Now, let's give you some tips on butt lift recovery. What we talked about so far are things you should expect after the operation. Now that you're well prepared, let's look at the 5 Brazilian butt lift recovery tips you need to follow to maximize your BBL results. Sitting and sleeping. Are you aware of how many times you're sitting down in a day? We sit down almost a whole day at work, in the nicely padded movie seats, at the dinner table, in the car, and etc. If you get a BBL, this is something you will have to avoid at all costs. With the exception of the toilet, you have to avoid sitting down for a period not less than 10 to 14 days after the procedure. This is because you need to protect the grafted fat. The new fat cells need to settle within the tissues and heal. Sitting down introduces pressure to the fat and prevents healing. You will also need to avoid sleeping on your back because it will add pressure on your buttocks. You will need to sleep either sideways or chest down during the entire recovery period. In case you're worried about unconsciously rolling over onto your back while sleeping, you could wear a backpack with a golf or tennis ball inside so that if you assume a back position, the ball will cause your back discomfort, making you shift onto your side. Compression garments. Following the BBL operation, the surgeon will recommend wearing a special compression garments to help treat the liposuctioned areas. It's recommended to wear the garment for a period determined by your surgeon to ensure that the areas will heal well. It also helps to minimize swelling, reduce discomfort, and help the skin contract. Exercise. You are advised to keep away from all high-impact physical activities or exercises until cleared by your surgeon. Performing strenuous routines before you have fully healed could affect the transferred fat. After about 6 to 8 weeks following the operation, the fat cells transferred will be stable enough to undertake vigorous exercises. Here is a quick guide of the useful butt exercise routines. Squats, donkey kicks, lunges, standing lateral leg raises, side leg raises, plank leg raises. Healthy diet. You will need to follow your surgeon's recommended dietary guidelines. This will include plans like eating well-balanced meals, low sugar intake, and fat consumption. You will also need to watch out for salty foods because this will promote liquid retention. Usually, after any surgical procedure, you want the swelling to subside as soon as possible, and consumption of whole foods containing low sodium naturally achieves this. Stay alert for infection signs. You'll need to be wary of the signs for a possible BBL infection. Such signs might include excessive amounts of swelling and redness. If either of these symptoms occur, you are advised to contact the surgeon immediately. Other less common but nevertheless serious symptoms that may arise indicating an infection can include an odor that is usually unpleasant, oozing from the wound, a fever, swollen glands, or increased pain. Now let's hear more about how long BBL results last and if we need to do a revision after 10 years. Usually, if you choose the right medical team, your surgery will go without any incidents and the result you get will be more than likely semi-permanent. You need to understand that the shape of your fat cells changes in time, so it's impossible to get a lifetime BBL result with one surgery. You can expect a BBL result to last for up to several years and perhaps even several decades depending on how well you treat your buttocks during the recovery process. Your BBL can and will last for decades if you treat your BBL in a way that maximizes your results. You have to understand that for the first 10 to 14 days, you should avoid sitting and heed your doctor's advice to get a fast recovery and heal properly. Your sitting and your recovery time mostly depends on you, your experience, your body recovery rate, and your doctor's suggestion. And in the end, we are going to talk about the question that have crossed the minds of all applicants. What will happen 10 years after having Brazilian butt lifts? Most patients can expect the results of a Brazilian butt lift to last for 5 or more years. In some cases, the results can last a decade if you treat the procedure to maximize the results. Most plastic surgery patients have excellent results with their BBL for years after surgery. After 10 years, you should have the same round perky shape to your rear as you did after surgery. As long as you don't put on or lose a lot of weight, you should see pleasing results 10 or more years later. It's also important to follow a proper diet to enjoy the best long-term results. Remember that the Brazilian butt lift doesn't address loose skin. If your skin becomes looser as the years pass, you might opt for a touch-up BBL. Adding additional fat to your bottom as you age can help to keep the shape the same for the long term. So in general, recovery time, body healing rate, following doctor's recovery tips, and time may have different impacts on each person, and you may need to have another BBL surgery. But usually those who get a positive impression from their first surgery may have a second or third surgery in the following years to get the looks they desire. We hope this podcast will help you and answer your main questions about Brazilian butt lift and what happens after. This podcast was brought to you by Iranian Surgery. We hope you have enjoyed listening to our podcast. For more information, check our website at iraniansurgery.com. Stay with us for more podcasts on Iranian surgery.